A deadly problem is getting even worse here in Cincinnati. That's the sobering message today about the heroin crisis we're always talking about. WLWT News Todd Dykes live for us, covering the overdose numbers now and what's being done to try and reverse the trend of our state of addiction. Todd.
Yes, Cherie, more than 120 people in Cincinnati have already wound up here at the coroner's office because of overdoses. That's nearly one every other day. Already more than all of 2016, and 2017 still has 3 months to go. Jennifer Mooney says if you think Cincinnati's heroin crisis has subsided even slightly, you're mistaken.
Our problem is not improving.
During all of last year, there were 1,676 overdoses, including 107 deadly cases in the Queen City. Already this year, there have been 1,733 overdoses with 122 deaths.
This is a chronic relapsing condition, so I think that most people who suffer with any substance abuse disorder, they're going to have this problem, and it's going to continue.
Because of that, Mooney says getting drug users into treatment is essential. Kristen McClure agrees.
If you want this, you can get it. You know, it doesn't matter where you are and what part of your life you are.
Sober for 5 years, McClure has lost friends to heroin, but she also has friends who, like her, have survived.
There's great stories, you know, and people with 30 years of sobriety, and, you know, and that's some of the stories people need to hear. You know, so that gives them encouragement, like, you know what, I can do this too.
Mooney and her colleagues at the Cincinnati Health Department are motivated by that hope. They told city council members today about the benefits of programs like Cincinnati's growing needle exchange and a quick response team in the Price Hill area. Afterward, council member and mayoral candidate Yvette Simpson recalled a spike in overdoses that stung the city 1 year ago this month. Since ODs keep rising, Simpson wants more treatment options.
So after a year since the spike, I want us to lean into what we're going to do more long term, and some of these strategies are actually ones that I believe can work.
Now, plans under consideration as of today include a database to help first responders better connect overdose victims with treatment facilities, also having police take custody of OD victims, those who do overdose. Some liken it to a form of civil confinement. Reporting live tonight, Todd Dykes, WLWT News 5.
Taking on the heroin crisis.
So our problem is not improving.
How Cincinnati is trying to reverse the overdose trend and our current state of addiction.
Losing more and more lives to heroin. Good evening, I'm Mike Dardis.
And I'm Cherie Pillow. The number of people dying from overdoses in Cincinnati continues to climb. WLWT News 5's Todd Dykes is live for us at the coroner's office tonight with the startling stats. Todd?
Yeah, Cherie, this is where heroin users end up when they take a hit that takes them out. It is a sad reality for an increasing number of drug users and their families. When she was an addict, death was always a possibility for Kristen McClure. Even now, as she helps others at the Center for Addiction Treatment, death is never far from her thoughts.
My best friend of 30 years just died last year from overdose. He's got 5 small children, you know, it's very sad.
But after 5 years of sobriety, Kristen is proof there's hope.
If you really want this, it's here, you know, and it's a great, you know, life.
But that's a message far too many people abusing heroin or painkillers are not hearing.
All walks of life. This just doesn't have any holds barred. It doesn't affect just one demographic. It affects all demographics.
And more people are overdosing. During all of last year, 1,676 people overdosed in Cincinnati. 107 of those people died. Already this year, 1,733 people have overdosed with 122 deaths. Jennifer Mooney with Cincinnati's Health Department talked about the rise in ODs at City Hall today. She also talked about efforts to stem the tide.
I don't know that we can say that these numbers that we're seeing this year, these increases, are necessarily due to the fact that we have no prevention efforts. I think it's just showing the true nature of this disease. I think that what we're trying to do is head this off in a holistic sense. We want to make sure we have prevention efforts. We want to save lives with naloxone, Narcan. We want to make sure we're getting people into treatment.
Now, Mooney says she's encouraged that around 40,000 syringes are being exchanged each month as part of a needle exchange program here in Cincinnati and also at a site in Middletown. She says that means drug users are having interactions with people who can get them help if they want it. Reporting live, Todd Dykes, WLWT News 5.
All right, Todd, thank you. By the way, the health department officials also telling us today Hamilton County is now involved in a research project with a company called Addict Pharma. As a result, the county has received $2 million worth of the heroin reversal drug Narcan.